Hello, my name is David Arnapol. I'm a nurse practitioner working with King University on my doctoral degree. Today, I'm going to be introducing Zoom, a service that my program uses in my office for telehealth services since the pandemic started. By watching this today, you should be able to answer the following questions. What exactly is Zoom? How is it being used for telehealth, especially in the time of pandemic? Who uses Zoom normally? And how does reimbursement occur for Zoom visits for medical providers? Also, what are some opportunities for telehealth with Zoom that may not have been thought of moving forward? Now, what is Zoom? A lot of people since the pandemic started have used this program either to stay in touch with loved ones or to have classes in academia. However, according to Zoom, they say that Zoom is a reliable cloud platform for video, voice, content sharing, and chat. It's extremely simple to use, even if it's not installed into any sort of device. And for telehealth services, with the current presidential order, they can be used with relative ease and little to no cost to either the provider or to the patient. All they need is internet access, which most Americans have on their smartphone. But who uses it besides that? Providers, patients, students, faculty, administration, anyone who has the ability to use internet and has a device with some sort of webcam, and sometimes without the webcam, just voice, has the information and the tools necessary to use Zoom as telehealth services. I myself as a provider have used multiple telehealth services, as this was my focus as a new graduate when I earned my nurse practitioner license. I have seen different services like Doxy.me, I've seen things through Aetna, I've seen a lot of them. However, I really like Zoom because one, it's completely free for what's necessary for telehealth. You can pay for more, as you'll see on those slides, but it's not necessary, especially with the laws like HIPAA in place. It's not necessary to record the videos. The free service will give you an unlimited amount of one-on-one meetings, which is what a provider would need with a patient, and can have, if necessary, up to 100 participants for a 40-minute meeting. Absolutely free for both the provider as well as for the patients. Paid subscriptions, like I said, are available. You have cloud storage for video recording. You can have multiple hosts if it's a complicated meeting. Unlimited participant meetings, personalized support, and identifiers for the rooms. And then those costs go from $12.49 a month, $14.99 a month, and can go up based on how many services. The most expensive plan I saw was $500 a month when looking through this, but that had over 50 different users that were going to be part of the account. It also included the ability to have large conference rooms, so it is completely based on what you need. But again, just for telehealth services, it's completely free. In terms of the user friendliness, Zoom is very simple to use on any sort of device. And for the providers, all they have to do is access the website or a mobile app on their phone or a browser extension that they can install into something like Chrome or Firefox. They can also just email a link directly to their patients. And for those who do not have it, but they do have a smartphone or don't know how to access their email, you can give them a phone number to call into. It will not give a video feed at that point, but they would still have the ability to simply call like they're used to doing, so they can still talk to the provider in a Zoom room. And once again, that's completely free. For the patient, it's just as easy. There's a link. When they click the link, if the things that aren't required, any packets or software that need to be installed, are not on their computer or device, it will prompt them to download it without having to go to multiple areas for it until it's ready for them to enter the room. That works for websites, mobile apps, browser extensions. They can use their phone. And they do not have to have an account necessary to join the room with the link. If they've never used Zoom before, by clicking it and installing all the software that's necessary, they're ready to go. they are in the room, even if their name says something like username or guest. They'll still be able to talk with the provider. When telehealth first started, many organizations and insurance companies were worried about patient safety, patient data safety, making sure that things were actually going to be private enough as if it was, if not better than, in a provider's office. According to Zoom, currently they use multiple end-to-end encryption devices and continues to provide future protection of user information and meetings. They have very secure waiting rooms, which they've updated multiple times since the pandemic occurred with COVID-19, where now a provider can go into the room and has to allow the patient into the Zoom room itself, because that way the room is both protected from people just jumping in and talking about it, and it is allowing both the provider and the patient to feel secure in that room so no one else will jump in. An extra benefit, though, besides just the patient and the provider, is the ability to collaborate with other physicians and other providers. If someone is on the other side of the state, it's difficult to always get a hold of them via phone or to show them something unless you're using email or a phone to do that. However, with Zoom, you can quickly get a hold of someone through telehealth services, Zoom, show them what's on your screen or what you're working with, not necessarily the patient, but what you're discussing, and then have a collaborative meeting so you can actually discuss your findings and what your thoughts are. Again, completely free. Patients do not need to always come into the office with this. This would open up the ability to see more patients, especially in simple acute situations like sinus infections, ear infections, to help make sure that they're taken care of without needing to drive far. And also to make sure that they have decreased risk of being exposed to anything that's currently out there, whether it be the flu, a current pandemic, or anything else. The data that is being transmitted is using crypto keys. It's called HMA CSHA 256. This is an extremely complicated cryptology that they use to make sure that anything that's being said across the video services can't be just taken and recorded by anyone except for who's actually in the meeting. And this also helps ensure connection integrity and security. One of the biggest challenges I hear about telehealth is HIPAA compliance. Everyone worries about their healthcare information being let out because of this quote-unquote unsecure services. Zoom has HIPAA compliance. First off, the information that's private, that's protected by HIPAA, is not available over Zoom. Any patient information does not go across Zoom. We don't show charts. We don't discuss anything like that. We do not share anything like that with the patient over the Zoom recording. However, we can discuss findings with them, but again, behind that locked door or behind that secure room. So, private health information is not accessible by Zoom. Meetings are not listed publicly. The only way to actually enter into a room is to have the meeting ID and password, or to have the link sent directly to them. Then, if they do have that, the provider, the original owner of the account, has to let that person in to be able to speak with them. So even with the password, even with everything that they need to get into the room, it still wouldn't let them go into it if somebody was able to hack into the meeting. Which explains right there how the host can force everyone in the waiting room. Meetings can be locked even further, even if the patient and the provider are both in a room. At that point, the owner of the account can choose to lock the door, quote unquote, where no one, even with the code, passcode, or password or link, can enter the room, because it then locks the room. And other challenges have been that patients are a little wary about telehealth. It's gotten much better since the pandemic, where people don't want to leave their house and they want to use telehealth, especially when they learn that most insurances are paying the exact same to make sure that they're taken care of through telehealth as if they were going into the office. Speaking of costs and insurance, reimbursement. As I said in the last slide, most every insurance is paying providers as if the patients are coming into the room or coming into their office for telehealth. They recognize the need to protect themselves and their patients from having to go into a place that tends to have a higher risk of having infection or people who are sick around them. In my office, patients pay before the visit by calling the office. They also have the ability to simply call and make a payment over the phone with an internet service, such as PayPal, Venmo, or other services. We offer something special as a side note for reimbursement where patients who have no insurance can simply pay a $39 flat rate where they get to do a telehealth visit, they get a telehealth assessment, diagnosis for any acute situation, prescription, and assistance with GoodRx to help find the lowest costs necessary for them. I have mentioned multiple opportunities throughout this presentation. However, just to kind of sum them up, the offering telehealth services through Zoom makes an easy access outside of office for both the provider to the patients and the patient's ability to get something maybe outside of office hours. It also increases income for providers because these meetings don't tend to always take the full 15 minutes necessary, especially in acute situations like a refill. It's also easier to follow up care. So when somebody has to say they have an ear infection and just want to go in and show that things are doing better, or if they've had a problem where they want to make sure that the medicine is not working, they can still have their follow-up without necessarily coming into the office using Zoom. Rural areas are taken care of for medical, mental health, acute and chronic issues as well, especially if they normally have to drive an hour or longer to be able to have that healthcare presence. And collaboration, being able to talk to other medical providers in times where you may not understand exactly what you want to do with a patient. In summary, Zoom is extremely useful for telehealth, and I personally hope that we can continue to use this once this pandemic is done in terms of telehealth, as it is has been very accepted by both providers as well as patients. It's safe, so the patients don't have to come into the office. The cost is very low, usually free, and people can see collaborating providers as necessary to make sure that if the provider they're seeing cannot answer their questions, they have those providers have the ability to actually get information and take care of their patients. Zoom is making primary care easy, cost-effective, and giving access to people who normally wouldn't have easy access to medical providing. 2 questions I want to ask you, the person who's watching this. What would be a useful tool to help take payment over Zoom safely and effectively? Other telehealth services like Doxy.me have the ability to take payment over the actual service. However, they do cost a higher monthly fee to have that service. As the need for telehealth continues, do you think insurance companies will finally recognize the need to allow telehealth charges on a regular basis? These are my references. And I'd like to thank you very much for watching.